Snoring or noisy breathing while sleeping is a common problem in children as well as in adults. It has been largely a matter of joke because when somebody snores, it is considered impolite and is a social nuisance. But snoring is not always a social nuisance. Snoring in its initial stage just causes disturbance because of the sound, but subsequently snoring turns into a serious medical condition called sleep apnea syndrome. Obstructive sleep apnea is a medical problem, it is a health hazard and causes long-term effects on the lungs, the heart, as well as predisposes you to stroke and sometimes sudden death. The mechanism of snoring and sleep apnea is as follows. Because of obstruction in the upper respiratory tract, snoring occurs. This is similar to Bernoulli's principle. The narrower pathway through which air passes, the more a sound that is produced. So as we breathe through an obstructed airway and snore, negative pressure of the snoring keeps pulling tissues further and further indrawn. Once the tissue is indrawn, it causes a complete collapse of the airway and the person stops breathing. This is a phase called apnea. This lasts for some time till oxygen levels in the body start depleting and carbon dioxide levels start rising, a condition called hypercapnia. When carbon dioxide levels rise, there is a threat to existence and the brain wakes up the body saying there is something wrong, there is a threat to existence, please do something. As soon as the brain wakes up the body, the muscle tone is activated, muscles are pulled apart, an airway is created and the person starts breathing. This cycle is repeated throughout the night, snoring followed by periods of quietness, which is when apnea occurs, and this is called obstructive sleep apnea. The problem with prolonged obstructive sleep apnea is that there is an obstruction in the nasal and breathing passages. This causes long-term pressure changes and bad effects on the lungs, the heart, and also gives you a poor sleep at night. Because there is poor sleep at night, you are sleepy during the daytime, a condition called daytime somnolence. We have examined daytime somnolence and found it to be amongst the commonest causes of vehicle accidents because a driver falls off to sleep at the wheel of a car. So snoring and sleep apnea is not a joking matter, it is a serious matter and must be taken seriously. In case you snore loudly and there is a possibility that you have sleep apnea at night, you must have yourself checked out as soon as possible. The doctor will carry out a complete and thorough ENT examination. We'll carry out some tests including endoscopic evaluation. Some X-ray or imaging may be done to find out the exact nature of your blockages. And after this, a sleep study or a polysomnography test is carried out. A technician will come and hook you up with various instruments to check your pulse, ECG, blood pressure and oxygen levels all through the night. The first part of the study is to determine whether you have obstructive sleep apnea, and if the study finds that you have significant obstructive sleep apnea, that you have many periods of apnea in the night, and in each period your SpO2 or oxygen level falls dangerously low, then there is a second part of the study when a CPAP machine which brings in air at a positive pressure, this is attached to you and it is determined whether this machine makes a difference to your sleep quality and also whether your snoring stops using this machine. The treatment of snoring and sleep apnea starts off with lifestyle modification. In lifestyle modification, we have to consider three important things. The first is weight loss. Obesity and sleep apnea are strongly linked with each other because of deposition of fat particles in the throat and around. The second is cessation of smoking, and the third is reduction, moderation or complete stoppage of alcohol. So obesity, smoking and alcohol are three features which increase or bring about snoring and sleep apnea, and they must be taken into account. The second part is some surgical procedure may be advised depending upon whether you have a nasal septal deviation, nasal polyps, enlarged tonsils, or some mechanical problem with your soft palate or uvula. If there is an enlarged base of the tongue, some surgical procedure may be advised for that. Sometimes advanced surgical procedures like hyoid suspension or mandible advancement are carried out so that the breathing airway passage increases in diameter and your snoring goes down. The other therapy, which is non-surgical, is using a CPAP machine. A CPAP machine has been in use for many years. It is attached via a face mask. It gives you air at a positive pressure so that all the collapsing tissues are pushed outward and you can breathe more comfortably. Most machines nowadays are self-titering and automatic, so you just have to set the titration and they will work for you throughout the night. Many machines are portable, so for those who travel a lot, a portable machine is handy. It is quite a life changer because your quality of sleep improves, and once your quality of sleep improves, your daytime activity levels become better. Once your daytime activity is better, you can exercise better, you can work out better, and start reducing weight and becoming more healthy and fit. If you snore or there is a doubt that you have sleep apnea, please do not delay. Have yourself checked out.